or the faja. So let's talk about the garment or the faja. So there are so many misconceptions about the faja. Let's talk about the garment or the faja. So there are so many misconceptions about the faja. It's kind of this mirror. Let's talk about the garment or the faja. So there are so many misconceptions about the faja. It's kind of this miracle cure. People think that if they wear a super tight garment, it is going to train their waist, turn them into skinny Barbie, get rid of stretch marks, get rid of loose skin, erase 2 pregnancies, cure world hunger, get rid of coronavirus, or get a vaccine. Not going to do any of those things. If that worked, you wouldn't be having surgery. What does the garment do? Well, this is what a garment looks like, a typical garment. This is a first stage garment. And the garment is there because it puts gentle pressure on to decrease swelling and prevent fluid collections. That's why we use a garment. If we didn't use a garment, the patients stay swollen for a really long time and they get fluid collections. So the garment is important, but it's not there for the result. As I've said many times before, what gives the result are 3 things: the liposuction itself, weight loss, and giving the results time. The garment is not even on the list. What makes a first stage and a second stage garment? So this garment is a first stage garment, and the reason that I call it a first stage garment is it's a little bit lighter material. It's not as fancy as some of the garments. There aren't as many adjustments that you can make because you're going to be using this garment for the first month after surgery. And this garment is going to take a beating. It's going to get pretty dirty the first night of surgery. You're going to be wearing it on and off through that early healing period, getting massages, etc. So you don't want to invest a huge, huge arm and leg into that first stage garment. Inside that garment, we're using foams, and we typically use 3 or 4 of these foams. These are foams that we put into the garment the day after surgery that allow that pressure to be smooth so that that garment can put pressure in a smooth contour. And we'll use a board. We tend to use this board after the drain comes out, and this board really is more important for patients after they start sitting. So for liposuction patients who can sit right away, we put this in after the first week. For fat transfer patients, it's really more important after those first 3 weeks. And the reason that this is important is it prevents people when they're sitting from slouching and getting lines. Once again, all of these things that we use in the garment are there to put gentle pressure. And the reason gentle pressure is important is, once again, the garment is not what's giving you the result. And tight garments will cause major problems. So you might be asking yourself, why is this garment they gave me a 2XL or a 3XL or a 5XL? Don't worry about the size on the garment. The garment sizes don't reflect the way that they fit. We don't want that garment to be tight. You're going to have a lot of swelling after surgery. You're going to have foams. You're going to have a board. That garment needs to give gentle support. If it's tight, it will not help you because tight garments will not get rid of intra-abdominal or visceral Rick Ross fat. Tight garments won't get rid of loose skin or stretch marks, and tight garments will not train your waist. I am your waist trainer. That's why you're here having surgery. So the garment is there to help get the swelling down and prevent fluid collections, but it's not there for the result. On the other hand, if it's tight, it will cause major problems, and I see these things walk into my office almost every day from patients who've had surgery in other places. Tight garments will cut off the circulation and they can kill the skin. Imagine wearing a tight rubber band around your wrist for 5 days. Your hand would turn this color and it would fall off. Well, that can happen in a matter of hours with a tight garment. That's what a lipoburn is. Lipoburns aren't burns. We're not using anything hot in surgery. They're from the garment being so tight, it cuts off the circulation and the skin, usually on the sides, dies. And then you end up with big open wounds that take months to heal and permanent scars that we can't even fix. This is totally preventable by not wearing tight garments, and you don't even need a tight garment anyway because the garment is not there for the result. The other thing that tight garments can do is create permanent creases, and I see this in patients who've had liposuction all the time. This is a picture of a patient who had liposuction 10 years ago in another office. She came back to me for a tummy tuck, and you can see this line in her upper stomach is permanent from her liposuction 10 years before. Even with a tummy tuck in this patient, that line was still visible, and she might need a further liposuction procedure to smooth things out even more. These are preventable things that we can prevent by not wearing a garment that's too tight. And remember, the garment is not what's giving you the result. So don't listen to your friends, don't listen to YouTube, Real Self, Instagram, Facebook. They're all wrong. Tight garments do not give results. What gives results? Liposuction, weight loss, and time. The garment helps us put gentle pressure on to get us where we want.